evening and welcome to Health Live at Seniors Today. Today we are delighted to have here with us yet again Dr. Megha Dhamne. Dr. Megha Dhamne is consultant neurology at the PD Hinduja Hospital and Medical Research Center in Mumbai. After completing her MBBS and MD in medicine from the BJ Medical College in Pune, Dr. Megha went to the US to pursue residency in neurology from the Baylor College of Medicine in Houston in Texas. Later, she pursued a fellowship in neuromuscular medicine from the Cleveland Clinic in Ohio. She has also worked in Singapore at the National Neurological Institute for 3 years before moving back to India in 2018. As I mentioned, she is currently with the Hinduja Hospital in Mumbai in Khar and Mahim. And after practicing as a neuromuscular specialist at the LH Hiranandani Hospital in Mumbai. Welcome to Health Live at Seniors Today. Yet again, Dr. Megha Dhamne, how are you?
Thank you, Mr. Maheshwari. Used to talking as, yeah.
So, the doctors.
Yeah, exactly.
So we've invited Dr. Megha Dhamne to speak about a topic that has come in as a request from our readers. This is diabetic neuropathy, prevention and care for seniors. So I would invite a doctor to make a presentation, and immediately after the presentation is over, as always, we will be inviting you to ask questions which will be answered live by doctor. But do look at the presentation. Most of your questions will be, I'm sure, answered in the presentation. And do note that this presentation will be on our site on Monday evening, Monday the 7th evening, and you can look at that. So if you don't have to make notes right now, and you can see it at that time. Over to you, doctor.
Yeah, thank you, Mr. Maheshwari. It's been a pleasure talking to seniors last time when we spoke about stroke, and now we move on to diabetic neuropathy. Okay, so my topic says diabetic neuropathy, walk your way to a better health. And I think that summarizes the topic as well. Let's see how. Okay, so it is a very common health problem. Patients experience burning sensation in your feet. How many of you feel there is a burning in your feet? You feel there is a cotton like feeling when you step on the floor, some abnormal sensation, feel like you are wearing socks all the time. I'm sure a lot of people have these symptoms. And so these symptoms are a sign that your nerves could be affected, and that's called as a neuropathy. Now, okay, so basically it causes an abnormal sensation in your feet. So, and the commonest problem is diabetes. Now I'm going to talk to you about a few cases which may seem a little realistic. These were the patients who I saw in the last few weeks at Hinduja. So let's look at this 84-year-old gentleman. So he walks into my clinic. Now he tells me that he's had burning feet for 3 years. My life is like a hell. I feel like cutting off my feet. He's saying it's very, very painful. But, he said, you know what, doctor, I had this hip surgery 3 years ago. And I started having burning feet after that epidural anesthesia I was given at that time. So something went wrong. They did something. They did the anesthesia and they numbed my nerves forever. So this person also has diabetes for many years. Uncontrolled, but now controlled. What do you think? He does have a neuropathy, yes. But what do you think is the cause of his neuropathy? Okay, is it epidural anesthesia? He was a little bit obese, I should say. Is it obesity? Is it diabetes? He used to drink alcohol for a while. Now he has stopped drinking, only a social drinker. So what do you think is the cause of his neuropathy? Now, I told him, Uncle, you have diabetes for a long time. It's probably multifactorial. That alcohol has contributed, diabetes has contributed, but probably diabetes is the cause of neuropathy. And he just refused to disagree with me, saying, no, it all started after the epidural. And that's a common scenario, you always see in the clinic that patients related to the surgery they've had, even if it's for years ago. Now he's asking me, can you fix it? Okay. And I'm wondering whether I can really fix what he was trying to ask because I couldn't convince him that it was not the epidural. So, what did I do? So, let's talk about what happens with diabetes and what did I do to solve his problem. Okay. Now, diabetic neuropathy can occur in both types, okay, type 1 and type 2 diabetes. Now, type 1 is not seen as commonly, and type 1 is seen in younger patients who are in 20s or 10s. They have a history of diabetes. These are children that we see with diabetes mostly, and they are insulin dependent. So, after being diagnosed with diabetes for years together, these patients have a risk of diabetes, like 25 years plus, I'm talking about. However, if you take about type 2 diabetes, which is what most of the adult onset diabetes is, 50% of them will develop symptoms of neuropathy during their lifetime. So it's pretty common. If you have a diabetes, you probably have a 50% chance that you will have a neuropathy. What are the symptoms? As we discussed, sensory symptoms in your feet, so numbness, abnormal feeling. Remember, if this is a diabetic neuropathy, which is a classical diabetic neuropathy, there is no weakness, no difficulty walking, no difficulty getting up from a chair, climbing stairs, okay, using buttoning, unbuttoning your shirt, lifting up your hands overhead. This is not a diabetic neuropathy. Diabetic neuropathy classically is numbness, burning, and tingling in your feet. Starts from the feet. So typically, a survey showed patients had varying symptoms. As you can see, we've discussed about this. It starts in the feet and it goes up as the neuropathy progresses, and only then it involves the hands. And that's the classical diabetic neuropathy. Now you wonder, why does diabetes cause neuropathy? There are several factors or mechanisms. Most of it is related to this high glucose load, also abnormal cholesterol metabolism in patients who have had diabetes, or what we now know metabolic syndrome. I'll talk about it for many, many years. And what happens is it causes decreased blood flow, causing what we call ischemia or reduced oxygen to the tissues and inflammation, and that causes damage to the nerves. So what do you see? Commonly, you will, if you look at your toes, you will have dry skin because the circulation is affected also over there. Plus, there are some nerves which regulate your blood vessel and your flow, which are the autonomic nerves. They are affected. So you have dry skin, cracked feet, you will have ulcers or wounds, cuts which do not heal for many, many months. So these are some symptoms that you may be having a diabetic neuropathy. Recurrent fungal infections, this is a toenail infection. So visit your doctor regularly. So if you have such problems, if you do not, if this progresses, then this is what you end up into. Fortunately, not, it is not common, but because the sensation is less in the feet, they can develop wounds. You may not notice that you have wound on your foot, and if left untreated, if it gets infected, also because of the poor blood flow, that what happens is it can end up into a gangrenous foot, causing to amputation. So you do not want to reach that stage at all, and you need to treat it early so that you do not end up into a complication. So patients will ask, doc, my glucose is controlled, so why do I have a neuropathy? Okay. So when you treat these patients, they are in your clinic and they tell you that this is a diabetic neuropathy. This is the commonest question I get asked. So glucose control has a good benefit in type 1 diabetes, which we see in younger age group. But what studies have shown is it has only a marginal benefit, only some benefit of glucose control in type 2. That means there are other factors in type 2 diabetes, which is the metabolic syndrome, which also contributes to neuropathy. Now, what is metabolic syndrome? Before we go to metabolic syndrome, I also want to address that even patients with pre-diabetes or impaired fasting glucose are predisposed to neuropathy for the same reason that there is inflammation, there is abnormal metabolism of glucose and other factors. So, pre-diabetes, impaired fasting, and now metabolic syndrome are some new terms that you could be hearing. And you would be surprised to know that, if these are the factors that cause metabolic syndrome, you are at a risk for neuropathy and you may not have diabetes altogether, but you may have one of these four things: a high blood pressure. Remember, 130/85, 150. Now, the other day, a patient walked in and he said, my blood pressure is 150/90. That's normal for me. I'm 65. No, we are targeting less than 130/85. So, a high blood pressure, high fasting glucose, excess abdominal fat. That's the commonest cause of obesity in Asians. We are sitting all the time, right? And dyslipidemia. This constitutes the metabolic syndrome. So that's your metabolic syndrome. And even without diabetes, you are at a high risk of neuropathy if you had any of these factors. Now, what causes metabolic syndrome? Self explanatory, I think. Childhood obesity is also on the rise thanks to the internet, laptops, phones, sedentary lifestyle, unhealthy diet, lack of adequate sleep, and smoking. So it brings in a package, which is the health package, I believe. You don't want to go on this health package. You want to go on a holiday package, but not this package because it's harming you, right? So beware about all these things. So, what happens? Pre-diabetes and metabolic syndrome and diabetes increases the risk for stroke, heart attack, as much as a neuropathy, fatty liver, and cancer. Right? So, studies have shown that a greater number of components of metabolic syndrome may play a role in nerve injury, not just in patients with type 2 diabetes, but also in those who may not have diabetes. I think that's important for us to know. And we have discussed what happens. There is inflammation, there is increased oxidative stress. So these are all difficult terms to explain, but basically there is damage, wear and tear because of high glucose and inflammation, causing increased risk of heart attack and stroke. And it also, for the same reasons, your nerves could be affected at the same time. So the common diabetic neuropathy is burning feet, but at times you also have patients with tingling in the hands, and that could be a carpal tunnel syndrome or an ulnar neuropathy. See, these are the nerves in your hands. So it's just a compression, and it's not complicated. It's very simple. Sometimes you just wear a splint in your hand, and symptoms go away. Sometimes you have weakness. Remember, if I told you in the previous slides, patients with diabetes neuropathy do not have difficulty climbing stairs, walking, getting up from the floor. But if they have these symptoms, then they have with weakness, and definitely these patients should see a neurologist, especially a neuromuscular specialist, because sometimes it is difficult to distinguish these neuropathies from autoimmune neuropathies where they are treated with steroids. Now, if you give steroids to a diabetic neuropathy, they can worsen the situation, right? So they can worsen the sugars, they can worsen the neuropathy. So these sometimes they have a very a dilemmatic situation where it's difficult to distinguish whether these are autoimmune neuropathies like CIDP or vasculitic neuropathy or a diabetic neuropathy. So these difficult or atypical cases need to be seen by experts in those areas. Now, a mention about cardiac autonomic neuropathy. So sometimes patients You will hear your friends or neighbors tell you, oh, I didn't have a chest pain at all, but then I went for my regular checkup and ECG was abnormal and I had a massive heart attack. I went for an angiography. Luckily, it was in time and I got saved. Why does this happen? Is because of this autonomic neuropathy. So these nerves that supply, they are the pain receptors which cause pain when there is a lack of blood flow to the heart. So these nerves, which are the autonomic nerves, are also affected in diabetes. So it's a sign that your diabetes can cause cardiac autonomic neuropathy. So they have a risk for sudden deaths because of because of a heart attack. So that is why your diabetes has to be under control so that the risk of autonomic neuropathy because of uncontrolled diabetes is reduced. Any other causes of neuropathy? Yes, we do rule out other causes of neuropathy before we say it's a diabetic neuropathy. Common causes are low B12, especially in vegetarians, and alcohol. Some of the medications also cause neuropathy, like cancer induced neuropathy. You must have heard about this. So, how do you diagnose? Symptoms, and symptoms. Patients tell you tingling, numbness, it's a neuropathy. Clinical examination is important. What we do here is nerve conduction study. So, if somebody has a chest pain, what do? We do an ECG. Similarly, if somebody has a nerve problem, we are recording the nerves here, which is called as nerve conduction study to, to diagnose a neuropathy. It helps the clinical exam. And skin biopsy is also a modality to diagnose diabetic neuropathy of small nerve fibers. It's not widely available in India, so it's not a very commonly done test. Now, let's take an example after having understood this of a 76 years old gentleman. Now, he does not have diabetes, but he's had a knee surgery and he tells his orthopedic surgeon that I have burning in my feet. So he sends him to me. Yesterday, I saw this patient. Now, what happened is he said he's tried everything, nothing seemed to have helped. This was about a year ago. And now he's telling me that he's not taking anything, but how can you help him? Now I asked him, do you have high blood pressure? He said, no. You took the blood pressure, and if his blood pressure was 160/100. And he's telling me, oh, my blood pressure is always 150, 140, and that's normal for me. Okay, but that is not normal. I mean, it's a high blood pressure for him, even though he's 76. He is now telling me I was on some cholesterol medications before knee surgery. Now I don't take anything. So this patient, he does not have diabetes, but he's got these two risk factors. He was also a little bit on the obese side. He's got metabolic syndrome, and probably that's the reason why he's got this neuropathy, right? So he probably has metabolic syndrome. Now you wonder, how do you treat these patients? It's a multidisciplinary approach. One is you treat them with medications. We need to titrate, first of all, control the risk factors, control diabetes, blood pressure, cholesterol, then lifestyle modification, diet, so that you control your risk factors as well. Then you treat the pain. There are various medications. We titrate the doses so that the pain is under control. Alternative therapies can be used. There are some nerve stimulation treatments, acupuncture, which can go hand in hand. Sometimes we give local creams so that the nerve pain is better. Now, this is also a common scenario because diabetic neuropathy is very, very difficult to treat. And that's what I want my patients to understand. Sab kuch kiya hai, but still things are not getting under control. And that's because of the multidisciplinary team approach that needs to be done. It's not that just you are treating with pain medicines. You have to work on lifestyle modification, and diet and control your risk factors as well. And that's where it gets difficult to treat sometimes. So, what can you do to reduce your neuropathy apart from what the doctor is prescribing to you? Is lifestyle changes, diet rich with fruits, vegetables, vitamins, exercise, most important, sleep on time. An elderly population, they will tell you, oh, I can't sleep, I don't get sleep, I'm taking a sleeping pill. How many of you are on sleeping pill? And it is partly also the gadgets which are keeping us awake. Yes, eating dinners late. So that also increases your risk of metabolic syndrome. So work on these factors, stress relaxation, stop smoking, and I'm sure your problems will be cut down to uh, almost quite a lot. And in fact, exercise and weight loss has shown to reverse. I'm saying these lifestyle changes has been shown to reverse diabetic neuropathy, not the medicines, right? So it's an all in your hands. Take care of your feet if you have diabetes or diabetic neuropathy. Visit your doctors, examine your feet for injuries, wear a good footwear, treat infections, walk, exercise, eat fruits, eat right, take medications, control risk factors. Okay, let's take a look at this. He was a doctor, he was obese, he was referred to me by a physician. He does not have diabetes, but he was morbidly obese. You can see his weight was 600 plus kilograms. Now, sitting, doctors also are sitting the whole day prescribing medications. He was a physician, not a surgeon. And he came all the way from Pune because his pain in his feet was so severe that he said, Doc, do something. I can't work. I want to help people. I can't get sleep. I can't function. I feel like cutting my feet. And if you see, he was on multiple medications. Just to name a few, pregabalin, nortriptyline, tapentadol, pramipexole, a lot of sleeping medications. He's not able to sleep and he's clearly helpless. So he came to us. He said, please admit me. I want to get rid of this pain. Now we admitted him. We just optimized his medications. And I told him about metabolic syndrome, lifestyle modifications. He comes back to me for a follow up. The good thing he did is he was with a regular follow up and we titrated his medications to a maximum level, got his pain under control, little bit, not completely out of it. But it was a surprise to see him after 2 months. He said, no pain. I'm feeling better. He came to thank me. How did this happen? Was it the medications? No. So, one good thing he did was he started eating a balanced diet and he lost 20, no, 10, 15 kilograms in 2 months. And he said, that's what he said. I made some adjustments and now I'm feeling better. I'm right on track. I can manage my clinic. I can manage my patients and I'm getting back on track. I have no pain at all. I'm so happy and thankful. So, what did we do? He has done his diet modification. And it's the realization that, if you eat well, you're going to be feeling well. He started exercising as well. And I think that's what helped him. So, the message to you is walk your way to health, and that's how you will take care of your diabetes, high blood pressure, cholesterol, and your neuropathy as well. Thank you.
Thank you very much. I think a very detailed presentation. I can see some questions that we have come, and I think you've answered most of the questions that have come in. However, having said that, I'll just look at the questions once again. So if you could just close the screen.
I will, yeah.
Just stop the screen share.
Yeah.
Great, thanks. There is a question which is, क्या डायबिटीज लोगों को फ्रेश फ्रूट चाट रेगुलरली लेना चाहिए कि नहीं?
So, see, that's also the question when I tell them eat fruits, they'll tell me, oh, I have diabetes. So, what fruits? It's going to increase my sugar level. So, I would suggest meet a nutritionist. They will guide you. That's the better way to go. Okay, spend on your health, spend on your nutrition. You don't want to spend on hospital fees and visits. Once you get a stroke or a heart attack, you're going to spend lakhs of rupees. You don't want to do that. So spend now so that your diet is under control. And I think that's the way to go, bottom line.
Right. Thank you. We have a question from Mr. Jambunathan, who's 77. He says he's had burning feet sensation for the last 15 years, absolutely non-diabetic, and he's presently being treated with gabapentin 100 mg twice daily, many combinations with pregabalin taken with little relief. What should he do?
Sorry, it was cut off.
Yeah, okay, I'll just repeat. So this
Yeah.
is a question from Mr. Jambunathan, who's 77. He's had a burning feet sensation for the last 15 years. He says absolutely non-diabetic, presently being treated with gabapentin 100 mg twice daily and many combinations with pregabalin taken with little relief. What should he do?
Yeah, so I told in the presentation that
Right.
you have to check if you have high blood pressure, cholesterol, hypothyroidism, obesity, work on those factors so that things will be under control. As far as medications, you will have to meet your neurologist so they can adjust your medications.
Right. Thank
So
you.
sometimes, low doses are used and they may not be helpful. So we need to titrate it to a good dose to be helpful.
Right. There's a question from Radha who says, I have spider veins behind my right knee now. I have intense pain in my right feet. The vascular surgeon says that there's no issue with blood flow. Then why am I getting intense feet pain and difficulty in walking?
Sorry, you have to see in person. I mean, these are not going to be able to, solve
Right.
questions online. Sorry.
Yeah, yeah, absolutely. Um, you've mentioned this thing, but still there's a question from Shamna Ravi. Um, is peripheral neuropathy treatable? Is there any connection between gastroparesis and neuropathy?
So, peripheral neuropathy is treatable, as I mentioned. Control diabetes, control risk factors. Again, I'm insisting on lifestyle as the major cause for all this. Work on losing your weight, work on your diet, and walk, and walk. Because sedentary lifestyle is most of us, elders, in fact, as well as children, it's the extreme age groups we are saying they're all addicted to mobile, right? And that's why we are not walking, sitting down and watching a mobile. So I think let's walk your way to health is the message I want to give to all of you. Even if you walk within the house, do your own chores, go out a little bit, talk to your friends, be happy, and that's going to be, it's going to be helpful to you as well. What was the other question he said?
Uh, it's basically about the spider veins.
No, the other one he said diabetic neuropathy. Is it treatable? The answer
Yeah,
is
it's treatable. Yes. Yeah, that was the question. Is there any connection between gastroparesis and neuropathy?
yeah. So see, if you patients have diabetes, there are nerves that supply the internal organs as well, and the heart, the stomach. Every organ is supplied by blood vessels and nerves. Okay. So diabetes can also affect these. These are called as autonomic nerves. So as I mentioned, diabetes, when it gets out of control, it can also affect the. So that is the reason why they can have gastroparesis. So and that's commonly seen in diabetes. They have problems with bloating or constipation, diarrhea, and that could be a symptom of autonomic neuropathy in patients with diabetes. And that's why they also have a high risk for neuropathy, so they are going to have all sorts of these complications.
Right. We have a question from Anupama Singh, who says electromyography, EMG, is good for diabetic neuropathy diagnosis. Is it available easily in India, and where is it available?
So I showed you in the picture,
Right.
to diagnose neuropathy is clinical and symptoms. Now, typically diabetes causes neuropathy in your feet, for which you can do recording of your nerves, and that is called as nerve conduction and EMG. So any neurologist can do it. It's easily available in India.
In fact, that's another question. Is there any doctor, specialized neurologist whom one should approach for diabetic neuropathy?
So I have done my specialization in nerves and muscle diseases. So I'm a neuromuscular specialist. So, I mean, any neurologist, a general neurologist can take care of you, or somebody like me who's into neuromuscular can take care of you. So that's
Right.
Yeah.
This is a question that we've received. Is diabetic neuropathy genetic? My maternal uncle had it, and I'm 61. Can I also get it?
So the cause of diabetic neuropathy is diabetes or metabolic syndrome, obesity, high blood pressure. Are all of these factors genetic? The answer is yes. So it is the root cause which is causing the problem. So, I mean, diabetes can be genetic. High blood pressure, high cholesterol, all these are genetic factors. I mean, that genetically inherited. So, what do you want to do if you don't want to get it? It's not like the gene is abnormal. It's because you are at risk for it. And that's because you take away your sedentary lifestyle. Most of the things will be taken care of. You eat well. So if you have a family history of diabetes and high blood pressure, you start walking.
Right. Thank you. We have a last question. Can one take a massage or pedicure if one has had diabetic neuropathy?
Yeah, why not? Feels good.
All right. Okay, there is a question which is, of course, the flavor of the thing. मेरा diabetes है, मैं मंजारो लगवा सकती हूँ क्या? Of course, this is not for neuropathy, but
Sorry, what क्या लगवा सकते हैं?
can I take a Manjaro injection? Because for diabetes, I know it's for not for neuropathy, but this is a
I
question
didn't
which
get. What is the injection they said?
the Manjaro, these new injections that have come in for diabetes control, and which
Okay,
help
of
in.
course. Yeah, of course. You have to get your diabetes under control, irrespective. For that, you meet an endocrinologist, get things. See, controlling neuropathy is not going to be just one man show. It's a multidisciplinary teamwork. Work with your endocrinologist or your diabetes specialist, neurologist, your physician if needed, your cardiologist, nutritionist, your physiotherapist if needed for the pain control and your imbalance if you have. So we need to work as a team together so that things can be under control.
Right. One last question. I think this is a question that you must be getting often. This is from Sunita Verma. She says, I'm vegetarian and I get numbness in my hand and feet. What can be the possible cause?
So that's what I mentioned in one of the slides,
Right.
that low B12 can cause a neuropathy. So that's the reason that you probably have numbness in your feet. So eat a diet which is rich in B12. Being a vegetarian is a challenge, but paneer, yogurt can be some supplements. But I think B12 injections and vitamins need to be taken if you have a low B12.
Thank you very much, Dr. Megha Dhamne, for this session. You've answered most of the questions through your amazing presentation, very detailed presentation. And thank you to you and the team at the Hinduja Hospital for facilitating this. We've had over 190 attendees here, and I can see that there are some 800 odd. I mean, I saw it half an hour back on YouTube, so there is a fair amount of interest in the subject. And we will be back next week with our next session of Health Live at Seniors Today. And do remember that this is our anniversary month. This is our 6th anniversary. So on July 15th, we will be having our even if I say it myself, our blockbuster anniversary issue. And next Sunday, that is July 13th, we will be also having our finale of season 18 of our Seniors Have Talent. As always, all the other programs are on the Evergreen Club Seniors Today offering. So do watch that. And we will be back once again with our Health Live at Seniors Today uh, on, uh, on, uh, uh, on, on this platform every week. Do note that this session and the presentation was amazing, as you've all seen, and we've got some feedback. Do watch it on the Seniors Today website, along with the takeaways, which are written by a medical practitioner on Monday evening. So you will have a good idea of what doctor has said and all her recommendations. Thank you once again, Dr. Megha Dhamne, for this session. Thank you.
Thank you so much for inviting me. And it's been a pleasure always. Thank you so much.
Thank you.
Thanks.
Subscribe now and press the bell icon. Never miss an update.